Good afternoon, and thank you for joining us for today's daily COVID-19 media briefing with London City Mayor Ed Holder and the Medical Officer of Health for the Middlesex-London Health Unit, Dr. Chris Mackie. A reminder that for the media who are watching, you can submit your questions, and we will direct them to either the Mayor or Dr. Mackie as you indicate, or in a question where it would apply to both of their roles, we will ask the question of both of them. Also, a reminder that we will be completing today's briefing at 2:30 this afternoon. And also a reminder that tomorrow we will also be joined by the Warden of Middlesex County, Kathy Burkhart-Jessen. And also a welcome to the viewers on Rogers Cable and also on the Rogers Facebook and YouTube channel, and to listeners tuning in on Global News Radio AM 980 CFPL. We'll turn the meeting over right away for comments from London City Mayor Ed Holder. Mayor Holder.
Thanks very much. A couple of things. Appreciate it, Dan and Chris. It's important that we continue to do this to let folks know, and I appreciate this so much. We'll hear from Dr. Mackie shortly about what the numbers are with respect to COVID from yesterday to today in terms of diagnoses and so on. But what I want to encourage Londoners and folks from Middlesex County, stay the course. What we're dealing with here is a marathon. It's not a sprint. And we cannot at all let our guard down when it comes to physical distancing. It becomes probably as much as so many things like hand washing and all the hygiene items that have been stressed. It is so critically important. And I'm asking Londoners and folks from Middlesex County, don't let all the sacrifices that we've asked you to make over this last month be in vain. It's our opportunity to save a life. It's our opportunity to make a difference. So we are more than ever making that point. Look, we do not know when when we've made the turn. So all the more reason that we pay mind to the absolute respect for each other, because what you do saves lives. The life you save may be your own, but maybe it's a child or a parent or an aunt or an uncle. So we ask you to please to be mindful. The other thing I'd like to mention as well, please, is that what we have done over the last several weeks is that we put together two task forces, the Mayor's Economic Impact and Recovery Task Force and the Social Impact and Recovery Task Force, looking at two things. We're looking at what the current impacts are now on our broader community, both in terms of our business community, our workers, those who are most vulnerable, and trying to understand exactly what it is we need to do. Do you know, we've spoken with ultimately over 200 groups and associations over probably now this last month, some 25 meetings, and the inputs that we have received from them culminated in a report that we released just this past Thursday night. And we've done that because we felt it was important with this first report to give a broad sense of what's going on in London and region. It really is a great document, something that's important. We'll be happy to release that to those who haven't seen it as yet. But that's a comment to the public to let them know this is the first report of several. We've already started back up. Today, again, we had two sessions with our Social Impact and Recovery Task Force group. And on Thursday, we actually had 4 different meetings of our Economic Impact and Recovery Task Force. What we're going to be doing with that from a municipal standpoint is taking that forward, and it will inform our administration in terms of some of the requirements that we're being asked to consider to help support the economy and to help support our most vulnerable. More than ever, it's going to be critical. That will come and take place with a report that will be presented at the end of the month to our council group. So with all of that, I want to give you a sense of that. That it's important, that input, because it is about caring for our most vulnerable and also to make sure that we have an economy to come back to. So with that, I'm going to turn that over to Dr. Mackie, and with my thanks to the community for their great support.
Thanks very much, Mr. Mayor. I really appreciate the balanced message there. We are right in the thick of the intense part of this pandemic wave in our community. And it's starting to level off, which is very reassuring. but this is not a pandemic that's going to drop off quickly. It's one that's going to be here for some time, weeks, not days, and it will still be some time before life gets back to normal. That said, important to celebrate the physical distancing measures and public health measures, business closures, all of that is making a big difference. We are really starting to see nationally the curve is leveled off to almost flat, so that we're seeing the same number of cases added each day, not any increases anymore nationally for some time. Provincially, things are flattening. I wouldn't say we're quite there yet, still some time to the peak, but we're close. And locally, the data is quite reassuring. Because our numbers are smaller, they do bounce around a bit day to day, but it may be that we are at or near the peak locally. It's even possible that it may have passed, but it will take weeks before we know that for sure. All that's really reassuring. A perfect time, as you said, Mr. Mayor, to start thinking about recovery and what does our economy look like? How do we really get people back to work in the future? At the health unit, we're very aware that work and income and employment are important determinants of health. And so as we look to help our community to be healthier, it's absolutely key that we have a high functioning economy. One thing I also want to mention today is about the facility that the Middlesex-London Health Unit has moved into at City Plaza, and what an asset that has been for our ability to respond to the coronavirus crisis. The main benefit has been that as we transitioned in a new facility, we changed almost all of our business processes, from the type of technology to the way we laid out our space. All of that meant that our staff is much more efficient and effective, and that we're able to save money. Lease costs in particular, we reduced our square footage from 85,000 to 68,000, about 17,000 square feet less than we previously had, or a 20% reduction, give or take. And that saved us over $200,000 a year, every year, for the taxpayers. That also, as we support our staff to move out into the community more and spend less time in the office, that meant going to modern technology. And so we've been able to update all of our technology. And what's that's meant is that we were, one of the first health units to have across the province to have staff working at home when the coronavirus hit, even before the public health measures announced from the Premier's office through the emergency powers. Forced closures of so many businesses. In fact, at this point, 90 to 95% of the 300 staff of Middlesex-London Health Unit are working at home, which we feel is really important. And you've actually seen at least one case of coronavirus transmitted from a staff person to a staff person in another health unit in Ontario. That's not the case in Middlesex-London. We have been able to get people working from home in a really effective way, and only would have been possible because of all the changes associated with the relocation and the investments in infrastructure and technology. So that's it for me today. Happy to take any questions, Dan.
All right. Thank you very much, Dr. Mackie and Mayor Holder. We do have a number of questions coming in, so we'll start with the first one. Dr. Mackie, this one is for you, and it comes from Steve Young at CTV London. Dr. Mackie, Steve asks, do you feel the numbers showing how many people are testing positive for COVID-19 in London and Middlesex is accurate? The numbers locally appear to be less than the provincial numbers, or are we simply doing a better job in distancing ourselves to stop the spread?
So our numbers are, if you look at them per capita, they're pretty close overall to the provincial numbers, maybe a bit on the low side, but not too much. We have certain advantages here, and geography is a big one. The fact that our population is more spread out than the GTA simply makes physical distancing a little bit easier. Most people in London and Middlesex can leave their homes, go for a walk without too much trouble in terms of getting into others' personal spaces. That is a lot more difficult in downtown Toronto or anywhere that you might be living in a high rise. So we've got some advantages there, and absolutely everything that people are doing in terms of the physical distancing measures and respecting other public health measures is making a big difference there as well.
All right, thank you very much, Dr. Mackie. Mr. Mayor, the next question is for you, and it comes from Dan Brown at the London Free Press. Mayor Holder, Dan asks, are bylaw officers out finding people during the week as well as on the weekends?
Yes, our bylaw officers, Dan, are ever present, as we like to say, certainly with a bigger emphasis on the weekends. But now that there is so much talk around staying at home when required, what is a weekend anymore? Is it a Monday? Is it a Tuesday? Is it a Wednesday? Let me say, here's the cautionary. Here's what we don't want people doing. We do not want individuals and their families going under caution tape in playgrounds and playing on that playground equipment. And there was a charge that was laid on the weekend on that very specific issue. We don't want skateboarders in skateboarding parks. We don't want kids playing basketball in basketball parks and on courts. It is so important that the distancing be there, that people respect these rules. And as I said in my opening comments, you know what? Don't let the hard work of what we've been doing, all of us, for the last month, and what you've been doing, what we've asked you, to be disrupted because the weather starts to get a little bit nicer, and it will. And I think Dr. Mackie has well pointed out, we don't know when the high point or the end point is and will be. So the precautions we're asking people to take are critically important. So we've laid about 3 dozen charges since we started this a couple of weeks ago, less since the very first day. So I'm hopeful that people are getting the message. It's a $750 plus some surcharge fines, not cheap if people are fined. We've gone through the education process, and as we said, if we can't seem to educate those who aren't prepared to listen, then maybe we have to educate their bank account, which is too bad, but that's part of the reality, I think.
Thank you very much for that answer, Mayor Holder. The next question, also from Dan Brown at the Free Press. Dr. Mackie, is for you. And just looking at the numbers superficially, it appears we're at a rate of death of about 1 death per day. A month into the pandemic and in a region the size of ours, does it strike you as a good number, a bad number, or is it immaterial?
Well, I mean, there is no good number of deaths. Every death that occurs is unfortunately a tragedy for the family that it affects. We are well below what some of the very drastic models predicted in terms of the number of cases and the number of deaths in our area, which is quite reassuring. But it's, we're not celebrating that the number is so low because, of course, 0 would be much better than the number of deaths that we have at this point.
All right. Thank you very much for that, Dr. Mackie. The next question is also for you. Comes to us from Sawyer Bogdan at Global News Radio, AM 980 CFPL. Dr. Mackie, last night you were tweeting about models you disagree with that are being used for decision-making and leading to policies that cause more harm than good. Which policies do you feel are doing more harm than good?
Well, we've had policies in particular around how the healthcare system resources are allocated that are well past their best before date. We've been moving patients out of the hospitals into long-term care facilities, for example, in order to be prepared in the hospital for those peaks. It's now clear that those peaks are not going to be anywhere near those dramatic modeling estimates. The hospitals are now sitting, in the range of 60, 70% capacity. Long-term care, which is a chronically stressed system, is now bearing the burden of additional patients coming out of the hospital, and they're, very, very close to 100% capacity in most places. And that's where we're seeing a real crunch right now. We're seeing, the resource levels are always under stress in long-term care, and with additional patients, plus the additional work of putting on and taking off personal protective equipment, the additional work of swabbing all the staff, those are really important things that need to happen, and they make it even harder in the long-term care to get to all the tasks that need to be done. So that's the sort of thing that I think we'll need to start rethinking as we go into the next phase, because we're not going to hit those hospital capacity numbers that were predicted in some of those drastic models, and we are hitting overcapacity, in a lot of the long-term care facilities. So we've got to really support those vulnerable people living in those facilities and the staff that work there.
All right. Thank you very much, Dr. Mackie. The next question comes to us from Sophia Rodriguez at CBC London. And Dr. Mackie, I'll give it to you first, but I think, Mayor Holder, there are going to be some aspects of this question that you might want to address as well. So, Dr. Mackie, we'll start with you, and here's the question. As the number of cases becomes smaller, a few health units across the province have cautioned about loopholes around physical distancing. In some places, neighbors have been socializing on their driveways, but what starts out as just two people chatting can quickly develop into half a dozen. Is this okay, or should people refrain from even getting together, even if they're maintaining a good distance?
Yeah, the short answer is that if you can't get together safely, you shouldn't get together. The more nuanced answer is that if you can, get together and you're very confident that you don't run the risk of, kids running through the group and, violating all of those social distancing measures. The other thing to think about is if you're gathering in, on your driveway or on your front lawn, there's also an important subconscious message that you're sending to your community, to your neighborhood. And that is that you maybe aren't taking social distancing, physical distancing seriously. And whether that is accurate or not, gathering in a public way can send the wrong message. So it's something that I would really caution people about.
So let me add in support of what Dr. Mackie has said. You may, in good faith and well-intentioned, go onto your driveway and come across a neighbor who may not have the same perspective on self-distancing you do. So all of a sudden, inadvertently, they come within the what I call the double reach danger zone, where in fact I think the risks are much higher. So what you never are sure of is what someone else's perspective is when you go out, even well-intentioned, to have a little chat. So there's risk to that, and we're asking people now more than ever to be cautious. We can get through this. We can beat this if we do not let our vigilance down. And it is so absolutely critical we do this the right way. We do it thoughtfully, and we remember that when we even encourage our kids, because I think the point was well made. You may be out there, and then the kids think it's okay to be out there, and then kids are gathering around, and that causes a number of issues. So the cautionary is still the same. Self-distancing absolutely at a minimum. No crowds greater than 5 at a minimum, but when possible. I mean, why do you think we all encourage people during the Easter holiday weekend to stay home and not invite their families? It's not because we wanted to be so punitive, but we felt that it was critically important to send a clear message that we can do this properly and safely with self-distancing. I mean, coming up, we know we've got Ramadan. We have, in addition to that, the Orthodox Easter coming up this weekend, and so we now get into the occasions of things, and we're asking people to continue the same cautionary approach as they have to this point, so that we can enjoy next year's Easter and next year's Ramadan and next year's Passover and Orthodox events. So that's just keep doing what you're doing, and don't let go now.
Thank you very much, Mr. Mayor, and thank you, Dr. Mackie. And if I could just take a moment to also emphasize for the folks who are watching the briefing today that we have 5 people involved in putting this briefing together who are all at remote locations. We are all in different places using the technology to bring you this information in a consistent, packaged way. But again, when Dr. Mackie was talking about how certainly at the health unit, I know the city as well, that staff are working remotely, we're still able to share messages and deliver those to you. All right, I'll step down for a second.
Dan, just on a quick point there.
Sure.
I just left a council meeting, a committee meeting chaired by Councillor Steve Lehman, and he was the only councillor in the chambers. Last week at the council meeting, I was the only council member in the chambers. Yesterday at the committee meeting, we had only one person who was from council who was in the chamber. And I think it's important that we continue to emphasize that, because this is about safe practice, and we also need to lead by example. So we appreciate what the health unit does as well.
All right. We'll go to the next question, Dr. Mackie. This one is for you, and it relates to a provincial announcement today. The government said they're shifting from the front lines of the battle to long-term care homes. This is from Sophia Rodriguez at CBC London. And Sophia would like to know, what does this mean locally, a shift from the front lines of the battle to long-term care homes?
Well, it sounds like the government must have been listening to our conversation a few minutes ago, so that's great. You know, the attention to long-term care homes is very welcome indeed. And as some commentators have pointed out, you know, we as a society aren't always as diligent as we should be at protecting and supporting our most vulnerable citizens, such as those living in long-term care homes. It's great that we now have that policy support from the government to move that forward. It's something that at the local level, various partners have been doing in various ways. And with the government shift, you know, I would hope and I would believe that the system would now shift to reprioritizing there where the impact is being felt highest. You know, you have significant numbers of cases right now. Long-term care is driving our new case counts significantly. And on the one hand, that's great that we're doing more testing in long-term care and retirement homes and getting more cases identified so that we can help isolate those individuals and keep the others in the facility safe. On the other hand, that is exactly where, you know, coronavirus is hitting hardest, and it's exactly where we need to continue to do more. So, great question.
All right, thank you very much, Dr. Mackie. Question from Sawyer Bogdan at Global News Radio, and this is for Dr. Mackie as well. Dr. Mackie, you said after we reach the peak, it will take some time where we will see cases. Do we know how long that might take when cases start to drop? How soon is it considered safe to leave our homes, or should people wait until there are no new cases at all?
So what we've seen in other countries around the world, particularly democratic, open market countries, is that it takes some time for that peak to come down. And the rates of illness being reported stay high for at least weeks, potentially longer. The exception there is the data out of China, where the rates dropped pretty close to zero and stayed there. And frankly, that data isn't particularly credible at this stage. So we certainly will be at this relatively high rate of illness for a matter of weeks.
All right, thank you very much for that, Dr. Mackie. We have one question from Dan Brown, and he's actually asked it of me, but I'm gonna ask it of both of you. And the first part is about how many people we think are watching the briefings, and that's something we'll have to check with our partners. But he's got a question about how we think it's going so far, using the technology to bring this message to the community.
Shall I start with that? And that's
sure, Mr. Mayor. I'll let you go first. Absolutely.
We'll let Chris do the wrap up on this. When we discussed this between us in terms of what's the best and most effective way to get messaging out on a consistent basis to our broader community, of course, we mean London and the broader community of Middlesex, we thought, what's the right way to do that? And we agreed pretty quickly that it made sense. Then some of the technical aspects of it were dealt with pretty quickly, and Dan will give you and Nathan Smith a pretty big shout out for getting that organized together. But then I think what's more critical than even process is the consistency of the message. There are different things that occur at the municipal level. You'll hear from Warden Kathy Burkhart-Justin tomorrow, and she'll give some perspective as to what's going on in the county. I've had this opportunity on a daily basis to give a perspective of what's going on in London and the broader community. But what you get from Chris, and I do not want to speak for him, except to say this is absolutely a medical pandemic. So the fact that the questions go primarily to the medical officer of health, I think is a testament, A, to the reality of the situation, and B, the credibility of that resource that we have in Dr. Mackie. I'm exceptionally impressed with his demeanor, and I think the community needs to hear this. And by the way, whether that community would be strictly the community of media, or now that we're live streaming, the broader community, I know at least one counselor has joined in today because he's here in my office about 12 feet away watching. But I would tell you that it's important that we get these messages out. And when every day I remind our listeners through the media or directly about self-distancing and why it matters. And when Dr. Mackie makes the statement about why it matters that we do what we do to save people's lives, well then, honest to God, we're doing that through this medium to save lives, to save Londoners, to save people in Middlesex County. That's what this is doing. So you know what? As much as it's a public service in so many ways, it's absolutely an appeal to people in terms of common sense, for the right reasons, for the sake of their families and for the sake of the community. So that's why I'm delighted that we do this. We do it every day. And Chris, I'll let you share your thoughts on that as well.
Well, first of all, appreciate your comments. I think your involvement, Mr. Mayor, as a leader of our communities is crucial here as well. And that moral authority and legitimacy that you bring is much appreciated. I'm happy with how things are going, mainly because you and the media continue to show up. There's no way to replace what our formal media does in terms of reach, in terms of ability to digest messaging and put it forward in a way that's going to resonate with their audience. The formal media, and in particular local media, are key to any public health response to any public health issue, and in particular in this sort of crisis. I would also love to hear your thoughts, Dan or others, Dan Brown or others, you too, Dan Flaherty, don't worry, but in terms of how effective you find this. You know, one thing that I am concerned about is the quality of the feeds, and so whether people are feeling that they're able to use any of the things that come out, whether it's video or audio, or whether they feel like they're having adequate opportunity to ask questions. I would be very interested in your response in the media. The question about how many people are reaching directly, I don't think it's a huge number. I mean, we know that there are. You know, last time I checked on when one of the local media was broadcasting, it was something like a dozen people watching live. But I'm also getting comments through the evening and the next day about people that watch the recorded versions as well. So, probably meeting the needs of dozens of people directly, but most important is getting your support to get those key messages out through your media channels, which is deeply appreciated.
And invaluable. Yep.
Thank you for that, Dr. Mackie. And yes, just a reminder that if you would like to see the recordings, you can visit healthunit.com or the City of London website, and you will find links to the recorded versions of the daily media briefings there. All right. We have one last question that has come in, and this one is coming from Grant Demi at MyFM in Strathroy. And Dr. Mackie, this is a question for you. The Prime Minister warned today that if we slowly let up on physical distancing measures too early, a second wave of COVID-19 could be far worse than the first one. How big of a concern is there that when things start to relax, the confirmed cases climb again? And what precautions should residents continue to take even after restrictions are loosened?
So we don't have great data around the world to indicate whether there would or would not be a second peak. I mentioned the data from China, which has lifted its restrictions, and essentially the country has stopped testing as a matter of national policy. So we can't really rely on the data there to say that there isn't a second peak happening that's just going undiagnosed. The coronaviruses, there are many coronaviruses, and we test for them every year in Canada. And we actually have about 4 years worth of pretty good data that shows a very clear seasonal pattern. You see cases start to pick up in January, peak somewhere, mid-late February, and then trail off by May each year in the Canadian data set of coronaviruses that are not COVID. That this would be previously existing data, and it's very possible that we may start to see a seasonal pattern with this coronavirus as well, not unlike what we see with influenza every year. We don't know for sure, only time will tell. Certainly anyone who is making decisions about that at local, provincial, or national levels is very aware of the potential risk of the second peak.
Thank you very much for that answer, Dr. Mackie. And that brings us to the end of today's virtual media briefing. Dr. Chris Mackie, Mayor Ed Holder, thank you both very much again for your time and for your answers today. And we will be back with our next media briefing tomorrow at 2 p.m. And we'll be joined at that time by the Warden of Middlesex County, Kathy Burkhart-Jessen. Thanks again for joining us, and we'll see you tomorrow.
Thank you.
Thanks, folks.